Hello, everybody, and welcome back to my YouTube channel. For those of you who do not know me, my name is Sneha. I am a certified soft skills trainer and a well-being skills educator. This space is all about personal growth, self-compassion, and high vibration conversations. The other day, myself and a dear friend who is a doctor working in Australia were chatting about mental well being. And both of us had a common interest that is making a difference in people's lives. So we decided, why not give you access to that conversation as well? And we decided on a comfortable time. This friend of mine, Dr. Madhu Rajan, addressed all important questions with regard to mental well being, right from certain myths about mental wellness, the stigma attached to taking therapy and going to a psychiatrist. How can family members support someone who's going through a tough phase? Then what is the difference between stress, high stress levels, and anxiety, fear, depression? And also how we can take care of ourselves, when is the right time to visit a psychiatrist, all of that, like really important information. So before we get into the video, I'd like for you to go grab a notepad and a pen and make notes in case you find anything that is of importance and you'd like to use this data for yourself. Also, please know that this is for educational and information purposes only. Dr. Madhu is not giving any medical advice on this video. It's a conversation to educate you. Make sure that if you need medication therapy, you need to visit a licensed physician, psychiatrist, medical practitioner in person. So, with that said, I'm diving right into the video. Hello, everybody, and welcome to this space. So, today I am being joined by a very dear friend, Dr. Madhu. And what we're going to be talking about is a very important topic in all our lives. So it is about our mental well-being. And first of all, welcome, Madhu, and thank you for taking the time out to educate all of us.
Hello, Sneha. Hi, thank you. Thank you very much for inviting me over. It's an absolute pleasure to, join you on the session today. And I think some of the things we're going to speak today might be relevant to some of you all. And thank you for the opportunity again.
Thank you. Thanks so much.
Yeah.
So before we go ahead, Madhu, if you could just tell everybody who's watching a bit about yourself.
Okay. All right. So I'm Madhu, and I did my MBBS from Bellary, and that's where I finished my basic medical training. And I went to UK immediately after I finished my MBBS. And over the next 16 years, I finished my MRCS, which is the surgical membership exams. Then I moved on to emergency medicine, and I stayed there for about 10 years. And I kind of changed the area when I started missing my kids' milestone, and I felt I needed to have some control over my time. And that's when I became a general practitioner. And after that, I migrated to Australia about 4 years ago. And I'm currently working as a general practitioner and also a custodial health physician in one of the female high secure prisons in Melbourne. And that's where I'm based at the moment. And that's where I kind of, developed my interest in the mental health space. And I thought maybe sharing some of those thoughts and ideas might be helpful for a lot of people out there. And that's the whole reason why I reached out to you. And here we are.
Thank you. Thanks for doing this. And wonderful to know about you. You are such an accomplished person, I must say. And I'm not saying this only because you're a family friend.
Oh, thank you, Sneha. Really, I wouldn't call it that way, but thank you.
So, Madhu, it's going to be an intense conversation because I have made note of a few questions that I really feel are very important to be addressed by an expert. Okay. Sure. So I'll dive right into the questions. Okay.
Yeah.
So the first question I have.
Okay, sure. Go on.
Yeah, is what are some common misconceptions about mental health that you encounter as a doctor? Because a lot of times people don't really know what they are going through. And like, I'll just give you an example. For me, for everything earlier, I would say I just picked this word up that, oh, I am depressed, but I didn't really know what it was until a certain point in time in my life. So as a doctor, what are some misconceptions that you've come across?
Okay. All right. That's a very good question. While mental health is very common, as per the WHO, about 1 in 8 people around the world suffer with some form of mental illness. With the same stroke, I would like to reassure not all everyday stress or anxiety are secondary to mental illness. I think you would probably resonate with that, isn't it? There's a lot of people, either it gets downplayed or overplayed that mental health is quite a serious issue. But, that's why I'd like to reassure not everyday stresses and anxiety are secondary to mental illness. To some extent, the media or the public portrayal of mental illness has been blown out of proportion.
Right.
And I think we shouldn't propagate a mass mental illness across the world. And I think in some shape or form, it's happening all across the globe. And I'm sure you would agree to that.
Right.
And I think people in power and media have to exercise some caution in this area and not use this as an advertisement tool, which I think is happening as well. And, you'd be surprised, as a doctor over the last 20 years, mental illness has been a challenge for me as well. And for a lot of clinicians like me and the medical fraternity at large, mental health is not an area that most clinicians are trained to recognize during your undergraduate training, especially if you have no interest towards mental health. So, for a lot of doctors itself, it's a challenge, especially if you're in surgical fields or other areas of expertise where mental illness is not really something they're well versed with.
Right.
And for the last 10 years, when I was in emergency medicine in the UK, I really didn't think much about mental health. I thought it was somebody else's job to kind of fix their mental health issues. My pure job was to be a physician there, treat their emergency, the emergency tasks that we were meant to handle and leave everything else to someone else.
Right.
And it all changed 4 years ago, Sneha, when I moved to Australia. So as part of my work in Melbourne, I initially started out working in aged care facilities for about 2.5 years. And that gave me an opportunity to learn about mental health in more detail, because I was kind of looking after people in their 70s and 80s. So if you have any doubts at any time, just pause. And I think I hear from colleagues that I speak a bit too fast, but at any
Not
time
at
you
all.
want me to slow down,
am
please let me know.
really loving the flow, and it's just absolutely perfect, all that you're sharing. I think it's very interesting. Please go on.
All right. So it was predominantly, I used to care for a lot of 100+ patients, and it was an absolute wonderful job, because, they give you a wealth of experience, all the knowledge and other information. It was a two-way process. And one of my patients was, in fact, a professor of psychology. And I think I was benefiting more than he was benefiting from me. And as part of my care, it involved palliating patients towards the last stages of their life and hand-holding in their last days. That gave me an immense opportunity to learn about mental health.
Yeah, I think for you also, as a doctor, end of the day, you're a human being, right? I mean, it's commendable that
That's right.
to handle that space. And how did you do it? Like, it must have been tough for you as well, right?
That's right. The initial stages was fine, because I kind of thought of it as a pure clinical role. But sooner or later, I mean, we're all humans, and I think it was taking its load on me, and I was feeling the strong sense of, or I got a sense of understanding what death is. And people are so accepting of their death, and they made plans, and I was like, wow, this is a new area of learning for me. But after that, I moved into the corrections role, where I was treating a lot of patients in the prison. I do a lot of hepatitis work, where I kind of do what's called as a fibro scan and treat patients with hepatitis C. So I kind of gained a bit of interest, but a lot of population in the prison environment have challenging mental health issues, mainly stemming out of addictions and other areas. And that kind of furthered my understanding of mental health. So coming back to your question, I'll kind of briefly outline a lot of misconceptions people have about mental health. I'll highlight some of the most common ones. I'm sure there's plenty out there.
Yeah, yeah.
So the most common one is mental health issue is a sign of weakness. I think you would probably resonate with that. I think it happens on an everyday basis when people don't want to do certain things. You just call it a sign of weakness. Mental illness is not as bad as physical illness. Now, this is another top misconception that's out there.
Yeah.
People with mental health illness are crazy and unpredictable. Again, this is a very common thing that I hear from, sometimes even medical colleagues. So seeking treatment is not necessary, and mostly with encouragement and some guidance, people can kind of snap out of it. And sometimes they think it's okay to stop treatments once you get better.
Yeah.
And to some extent, stress is the same as mental health disorder, which I don't think is the case. So I think these are the top points.
I'd like to know, like you just mentioned about medication. I think we must throw some light on this particular aspect, because a lot of people then get back into it, and it's even more worse, because through personal experience, I'm saying this.
Yeah.
Right? What would your advice be? Like, we should not just quit medication, right?
That's right. I mean, I think there is a role for medication, and most clinicians, I mean, either it's a primary care physician or a psychiatrist, they'll make a decision on how long you need the treatment. Now, you don't really require treatment for life. Now, some conditions require treatment for life. So I think I wouldn't do anything on your own. I think mental health has to be supervised. You have to make sure, you kind of attend your follow-ups and and really leave it to the clinician, and they'll make a decision for you. And I think I spoke to a friend of mine who's relocated from Scotland to India, and he was telling me about how easily things can be mismanaged, and patients. Of course, in India, Sneha, to some extent, everybody's an expert. Starting from being an expert in cars to talking about a simple thing as well. You get the best fruits.
True. The new age doctor is like Instagram, Facebook, YouTube. I think we should be so careful. Like, my dear friend, you're watching this right now. Please get your notepads and pen. I forgot to mention that. Please make a note of anything that is like a bulb on moment for you, or any key points you'd like to, keep a note of. So please do that. So let's move on to the next question, Madhu. Is there anything else you'd like to add to what you were saying, or I can move on to the next question?
Yeah, you can move on to the next points there. We'll kind of do a bit of catch up and highlight and summarize all the points towards the end.
All right. So the next question is physical and mental health interconnected? See, because why I'm asking you this is, a lot of times I've heard people talking to me about this, and I too feel that way. Now, let's take, for example, exercise, workout. My dad itself, he keeps advising me, Sneha, no matter what you do, whether you work out, you stop junk, but if mentally you don't feel that it is helping you in any way and you're obsessing about it, it's not going to happen. So it is not just your exercise or the food, but also how the kind of food you're feeding yourself mentally as well. So is it interconnected really? I would like to know your perspective.
Absolutely. I think that has nailed it on the head, Sneha. I think it's perfectly right what you're saying. So I think physical and mental health are deeply interconnected, and they have a significant bearing on each other. And I'm sure a lot of you would have heard the adage, which we've heard from the time we've been in primary school, a sound body and a sound mind. And this can't be further from the truth. Because the hormonal system and neurotransmitters essential for overall well-being have commonality in physical and mental health. I can cite some examples how physical health impacts on mental health issues and vice versa. Now, depression is a common event post-heart attack, and depression in turn increases risk of future cardiac events. Now, the main focus, if you ever, kind of saw someone at post-cardiac rehabilitation, is purely on physical health. But nobody focuses on depression. And depression is one of those things which is very, very common after heart attacks or any major events like stroke. You've gone through a major, surgery of some form. Depression is very common, and nobody really addresses it. And when you talk about depression, it certainly increases the risk of future cardiac events or anything along those lines.
Right.
And mental health issues like chronic stress, anxiety, and depression, it leads to lowered immunity states. And that contributes to cardiovascular risk like high blood pressure, metabolic diseases, gastrointestinal disorders, and many, many such things. And in many ways, there is a direct link between physical and mental health issues, and addressing them simultaneously has greatest benefit on long-term treatment adherence. And to a great extent, it reduces overall healthcare costs, which I think is important. I think as much as insurance covers your costs and everything else, there's definitely any amount of saving
Right.
is saving for
I
you.
just
And
wanted to know
yeah,
now, see, I am somebody who gets hyper. I may be a well-being skills educator, but like end of the day, I'm a human being, right? So I do get
absolutely.
hyper and I do get a bit scared. Now, when you said that if you are going through depression, it can also have an impact on your heart. So, what is going on in my mind right now is, oh my God, I hope I'm not
Yeah.
going to get a heart attack. So, how to deal with fears like that? I mean, it's not that easy also,
It's
right?
not an easy area at all, Sneha. I think it definitely needs to be addressed, and I think the healthcare system right now in India is probably at its best. I would say, especially in places like Bangalore, you can get all sorts of specialists. And I think in this area, instead of read, I mean, I'm sure you can get a lot of information out there online, and you have colleagues who've had personal experience.
Right.
But most of the time, it's not one size fit all. To some extent, they have to tailor it to your needs. And I think there is a role for a therapist. There is a role for experts in the field. And I think if you have the means and the facility to facilitate this, I think it's probably a good idea to speak to someone will be able to make a better better decision for you on your behalf.
Yeah, I think
As much as you can steer the whole thing, yeah.
yeah, no, what I get out of this particular conversation is that, I mean, it's very important to address what's going on, share it with the right people, than just talking to anybody. And for me also, I used to always think therapists can't really help me. It's just a psychiatrist. First of all, initially, I did not know the difference between a psychiatrist and a therapist. So until I went to
Okay.
a lovely place called Amaha, which is in Bangalore. So my psychiatrist then put me on
Okay.
to a therapist. And
Uh-huh.
initially I felt all that he's talking about, I know about it. Why is she talking to me about it? How is it going to help me? But then I think they are trained and they have a way to put it across to us, and that is very helpful. So
That's
thank
great.
you so much for sharing all of this. I
Yeah,
think,
sure.
and the examples you've mentioned are apt. Yeah, it does. I think, yes, it is definitely interconnected, physical and mental.
Okay.
Okay, so
Yeah,
I'll move on to the next question then.
yeah, sure.
What are the signs someone might be struggling with mental health and how can loved ones support them? Um,
Okay.
so, sometimes a lot of anxiety and fear itself, people think it is depression. And, I mean, how do we really know that one needs to go to the psychiatrist?
Yeah, that's a very interesting question, Sneha, and I think it's something very relevant because I think there's a lot of mental health out there. Like I said in the beginning, it sometimes gets downplayed and sometimes it gets overplayed. So I think striking the right balance is very important. So the most common signs which would be immediately recognizable would be behavioral changes. Often people whom friends, family members, or colleagues, whomever that is, often lose interest in their everyday activities. They go into a shell. There's some degree of social isolation and withdrawal. You could, notice signs of physical neglect. Sometimes it might go as far as engaging in antisocial activities like gambling or risk-taking behavior of that sort. And emotional signs are hard to recognize early on in the illness, like somebody who has low self-esteem, persistent sadness, or emotional dysregulation, where anger is disproportionate to what you've said or what's been spoken to them. And people often pretend that they're okay until their symptoms become overt. Quite often, mental illness is associated with physical symptoms like chronic tiredness, fatigue, sleep pattern disturbance, changes to weight. And these are the things, once it gets to that stage, that's when a clinician will be able to immediately pick it up. But I think family members, and friends play a key part. And quite often, I think it's hard, but sometimes if you feel something is amiss, you should try to speak to them in an understanding, calm and non-confrontational and non-judgmental manner. I think we thought about this in medical school, so we get good at this, but it's not an easy task even for doctors. I'd say, people who are psychiatrists and psychologists, they have challenges in some form or another. Now, Sneha, as much as people know they have to be calm and non-judgmental, quite often when they're met with a lot of anger and swearing from the person in question, it's at this juncture you have to stay composed, as even a single word or sentence will breach their trust. And once you lose that trust, it's very hard to engage with even friends and close family members. And again, there's no one-size-fit-all approach when it comes to mental health recognition and management. And I would say the best solution in the scenario would be encouraging them to see a clinician, and especially if they have expressed suicidal ideation, or if they've not got adequate protective factors like having a family or children. They're usually at high risk of doing something silly to end their lives. And this is a crisis, and I think definitely needs some form of escalation that they can, seek immediate clinical help. And quite often, single males are still by far the highest risk factors in society, and that's something which is not changed. Young male, single, who has no protective factors, they're at highest risk of committing suicide. And it's still happening all across the world. I think Japan is leading the figures by far. So I think these are, some of those points I would say are important to recognize and when to talk to them.
Yeah, thank you for this. And really, I think I would hats off to my husband as well, because I went through a few of these issues, and he educated himself as to how he should handle this for me. Because initially, he was like just talking about, don't worry, be positive, everything will be fine. Now, this positivity is just, this word is used so loosely, and it's not that easy when you're going through a tough phase. If there's so much fear within you to just feel positive all of a sudden. So, I think as much as it is very important for the person who's going through it, it is also important for the family members to understand what the entire scenario is actually. So I think that kind of support is very important. So I would like to take this opportunity to thank my husband if he's watching.
Oh, he's done very well. I think that's the most important thing. I mean, friends and family members educating themselves, because it's they kind of might trivialize the whole thing by saying, "Oh, why are you behaving like this? Why are you throwing a tantrum?" Or you were okay all this while. What happened now? So I think once somebody takes the effort to educate themselves, that's a game changer when it comes to managing mental health issues. So full credits to Avinash. I think he's done a great job.
Yes, definitely. Yeah. Thank you for sharing, Madhu. So I'll move on to the next question. How can one differentiate between everyday stress and more serious mental health concern? But I think you did talk about it in the previous question itself. Would you like to add something to what I just asked?
In simple terms, Sneha, if you're largely functional, you're able to do most of your everyday activities, you're able to hold on to a job, look after your kids and family members, I think it's probably likely to be everyday stress. But the pitfall is if you don't address everyday stresses or stresses appropriately, then that can become a persistent issue, and that can lead to more serious mental health issues like chronic anxiety and depression, which is very common these days. We see it day in, day out in the public healthcare setup. We see it in primary care, we see it in secondary care. So that's the main issue if you don't address them early on. And quite often, if the emotional response is disproportionate to the trigger, and if the symptoms persist even after the trigger is addressed, it's likely to be secondary to mental health issue. So in simple terms, if it's a persistent problem which is affecting you and affecting your function, then I think I would class that as a more serious mental health problem.
Okay, so when should someone seek help from a professional, and what kind of support can one expect from the professional? So again, I think it's an extension of what we are talking about.
Yeah.
But still,
Yeah.
is there a specific point in time we should, it's high time I need to see a doctor?
Absolutely. Now, if the nature of your mental health issue, like I said, if it's persistent and if it affects your everyday functioning, then these are alarm bells for you to seek help.
Right.
So again, some of the other points I've already addressed it before, but I'll reiterate them again. There are numerous other associated, physical symptoms like unexplained fatigue, bowel issues, psychological symptoms like constant rumination, prolonged trauma and grief, anything like poor coping mechanisms, including addictions and substance use, which we see a lot these days. Hepatitis space, drug use is very common when people have hepatitis C. And, so I attend this presence conference, and recently they said about 2 to 5% of the products, they don't even know what it is. So there's so much synthetic drugs which are being produced, and that becomes a challenge for a lot of clinicians because you don't even know what antidote to give them, and they come in very sick. So it's quite a challenge, Sneha. So addictions and substance use, I would say, is on the rise. And if you think there's something amiss, your friends or family, and you think they're kind of not clocking into work or their behavior suddenly changed, that's the other thing to kind of suspect and talk to someone who's close to them. And this constant emotional instability with significant mood changes, again, that could be a marker of something which needs to be done. Now, I think if you can adapt a simple method, you can talk to a close family member or friend who are receptive towards you. If you're someone who does not like to involve a family member, then talk to a clinician who's either a psychologist, a psychiatrist, any kind of accredited therapist who might be able to help you. And clinicians normally use, usually they use questionnaires. Now, the most common one is something called K10 or the Kessler Psychological Distress Scale. I don't know what they use in India, but there must be some form of questionnaire to find out what might be the underlying symptom. Now, normally most clinicians would engage in talking therapy in the initial stages. And I'm sure you must have heard of CBT and DBT, Sneha?
Yeah.
Yeah, so CBT is the most common approach. Now, in CBT, mostly, the idea is to identify and change negative thought patterns. DBT has become more common these days because it focuses on emotional regulation and interpersonal skills. Your therapist will be in a position to identify a mental health issue if it's more serious, like something which has an organic pathology like schizophrenia or organic psychosis. Then you probably need input from a psychiatrist, and probably most of them end up needing medications. And there's quite a lot of other gray zones which has come in now, like borderline personality disorder, emotionally unstable personality disorder, post-traumatic stress disorder, and ADHD. I think ADHD is doing the rounds all across the world at the moment, which is attention deficit hyperactive disorder or attention deficit disorder. And most of these patients, I think therapists would be a secondary role. Initially, they have to be seen by psychiatrists to be able to make the diagnosis, and post review, maybe a therapist can follow them up. But if it's a clear case of some kind of organic psychosis like schizophrenia or bipolar disorder, they have to be in the remit of a psychiatrist.
No, I would also like to add, so before I continued with this one specific therapist, I did meet a few people before I met this particular person. So I also feel it's very important for the patient also to ask questions, because people just use terms which common man cannot really understand. No? So it's very important. I think we should also find out when about a particular therapy system or anything, like you said, CBT. Now, most people don't even know what it is just because of Instagram, Google, thing. But then it's very important, I think, that as the patient as well, we should find out. But sometimes what happens is one will be going through so much, and then we really don't know what to ask, what not to ask. So I really wish therapists are also watching this and they make it clear to the patient what are they actually advising the patient to do, isn't it? I feel like I may be wrong.
That's absolutely right, Sneha. I think everyone should, especially if you're working in the therapy space, I think you've got to arm yourself a little more with these areas, because I think if you can really tailor the treatment much better, and I think the whole idea is to improve their overall quality of life. So the more you arm yourself with knowledge and information in this area, you're going to be able to give a more educated answer to these patients. And quite often, patient outcome, once you recognize what it is, and if you think, this is what it is, and sometimes, signposting them to the right service would do a huge, it'll have a huge impact on the patient's overall, rehabilitation in this area.
True. Madhu, the next question I have is, what are some effective strategies to manage stress and anxiety?
All right. I think that's probably the most important question, Sneha. Now, I'll give you a bit of historical background. Now, stress and anxiety is not new. This has been part of our genetic makeup since Homo sapiens arrived on the planet over 300,000 years ago. Probably just the nature of stress has changed. Maybe 300,000 years ago, probably it was a saber-toothed tiger outside your cave.
Okay.
Now, maybe it's your manager standing outside your office room. And to some extent, stress is what drives us and ensures our survival. Hence, I don't see this as a problem. But modern day has thrown a plethora of challenges to us. So vast majority of people are unsure of their purpose or goal in life. I'm not sure if you've heard the Japanese concept called ikigai. There's something which has resonated with me recently. So, what it says is the purpose in our life which aligns with your passion, mission, and vocation. And in simple terms, it is what it says as aligns with, align with what your passion is and address what the world needs and also get paid for it. That's what ikigai is all about. It's a simple and beautiful concept. And sometimes this is what we need to do. Pause, reflect, and resolve. I mean, that should be the main purpose of a lot of our lives. And the solution to tackling everyday stress lies in how we deal with this overwhelm. I would say focus on the basics, and you've already tackled 60 to 70% of your problems. I think Dad has rightly told you about good food, sleep, and activity. Yeah. And that's still the key to overall well-being, Sneha, because the gut produces about 80 to 90% of serotonin. So you can imagine why gut health is so important to us.
Right.
Yeah, if you have good gut health, you can be guaranteed your mental health is going to be okay. And, this visit to Bangalore was an eye-opener, I would say. The number of food options that's there. Every street you turn, there's a biryani house, there's a, chaat bandar
and whatnot.
Food trucks, absolutely. And the whole host of online ordering options. I think that would defeat even the most determined minds. So I think let's keep things simple. Yes, in simple terms, your food should contain an ideal mix of proteins, carbs, and fats. If you can keep that as protein 40, carbs 30, protein 60, proteins 40, carbs 30, and fats 30. So that's the ideal mix, what we advise most patients.
Mm-hmm.
And, to some extent, replacing protein as the principal nutrient would also help you. And, I'll tell, if you have a bit of time, I'll touch briefly on the kind of foods you're meant to be eating. And this is the advice we give most patients.
Very important.
Whole grains, all right. Whole grains, healthy fats, lean protein, reduce refined sugars, low caffeine, and low alcohol. I think that's probably a good mix of food to eat. Any form of fermented food is a great source of probiotics, which your gut needs. And, that'll kind of improve your overall immunity as well in the face of all the modern pandemics. There's going to be a whole host of viruses, which is going to come as the years progress. So I think maintaining good immunity and any form of fermented food is great for you. Yogurts, kefir, sauerkraut, if you like kimchi, anything like that is great.
What about Yakult? I've heard it's a probiotic.
Yakult is great. Yakult is great. I mean, because it's got good amount of probiotics. So if you have even one Yakult every day, it's certainly going to give you, a huge quantity of probiotics which your body needs.
Oh.
And the second, so Yakult is a great source of probiotics there.
Mm-hmm.
Yeah, And I did think, kefir was available in some of the supermarkets. It's kind of a fermented yogurt drink, and that has a high quantity of,
It must be available. I'm
probably,
not sure, but yeah, I'm sure
yeah,
it
yeah,
is. Yeah.
that's right. And the
Got
second most important thing is sleep. I think 7 to 9 hours of sleep is a minimum, with 30 to 60 minutes of activity every day. And I'm sure we all have an hour's worth of time every day, and that should be an absolute non-negotiable as far as I'm concerned. And most healthcare professionals would kind of agree to it. At least 30 minutes. If you're absolutely flooded, then it's a different story. But even if you're kind of flooded with work, then maybe taking a few minutes of walk to and back from the office would certainly help you.
Yeah.
Now,
So you're
the
saying
other
30
important
to 40 minutes of workout,
30
simple
to 60
workout.
minutes, you can, but
Okay.
at least a minimum of 30 minutes every day, brisk walking or any form of activity.
Yeah.
I'm sure a lot of people are doing it already, but I think
No,
that
I
should be
think,
a
I totally get what you're saying, because sometimes what one does it, like we feel, oh, walking is so underrated, right? We all know about it. So walking is nothing, and I might as well not work out today because I
do
missed
anything.
the day, and yeah. So I
Yeah,
think even something as simple as a walk, it may seem
yeah.
simple but very effective. I
Very effective, Sneha, because I think the whole world is talking about bone health, because everyone's aware now of osteopenia, osteoporosis, but muscle degeneration happens equally. As you get older, you'll see a lot of people struggling to get up from low chairs, and that's because of muscle degeneration. And any amount of walking, usually taking stairs,
yeah.
anything along those lines would certainly help your muscles. So a bit of weight training and resistance training as you get older, now I mean, not you, but I'm in my 40s, so I kind of have to think about a bit of muscle training, because that kind of will dictate how you're going to progress over the next decade or so. So a bit of weight training definitely will make a difference to most people's routine. And I think the other thing I've noticed is the social media. I mean, that seems to dictate the modern world. We live in a world where it's almost an inescapable part of a life.
Yeah.
And regulating your consumption is definitely going to help your cognitive burden. I think in some sense, the brain is literally overcooked. And
Yeah.
a lot of us can't do anything novel because, we're already kind of working with a very tired and overworked brain.
Yes.
Yeah. Would you
So
agree to
much
that,
overthinking.
Sneha, or do you have a differing opinion on it?
No, not at all. I think I totally agree with you. So much
Yeah,
going on in our minds and so much information out there. I
that's right. That's right.
Yeah.
And other simple measures like, which would cull your anxiety to some extent is, practicing mindfulness, building resilience. I'm sure a lot of the audience, they're already aware of this.
Yeah.
And there's a whole host of options for stress reduction. If you're unsure where to start, then probably speak to a professional, a therapist. And for those of them who don't like to see someone face to face, there's online apps like Mindspace and Calm, which certainly has its own charm. And I think dedicated spaces and tools like this gives you a lot of relevant information than the WhatsApp forwards I get every morning and
Yes.
things like that.
Yeah,
Can digress
it's
from.
called the
Uh,
University of WhatsApp or something like that. Someone had sent it to me. Yeah, very true.
I,
I don't think we should just blind follow what people are saying. I mean, I'm sure there are a lot of people who are relevant and certified to speak about it, but also one should be careful before you go ahead and just
yeah,
trust
yeah,
anything. I agree.
that's right. That's right.
Yeah, that's great. Thank you so much, Madhu. Before I conclude, I want to ask you if there is any message you'd like to give to all those who are watching you right
Oh, yeah. Thank you, Sneha. Thank you for the opportunity. I mean, it's been great collaborating and doing this session with you. I think in simple measures, we all go through a phase where we have to endure some degree of stress and anxiety, and almost always nobody is exempt from this rule. Probably a handful of people maybe are exempt from this rule, but most of us are going to endure some degree of stress and anxiety in our lives. And
now.
as you can see, with the medical advances in the medical field, we're kind of living longer. So I think we're going to endure this situation at some point in our life.
Yeah.
I think instead of focusing on avoiding or thinking something unpleasant should never occur to us, we need to arm ourselves with ability to tackle any situation. I think that would be my key message. Now, stress, anxiety, and minor stresses are always going to be part of our lives. Radical acceptance of this it'll not only calm you, but also help you thrive in these environments. So I think a degree of stress is definitely useful because a lot of us perform better. If you create an environment like a vacuum where there's no stresses, I don't think a lot of us will do very well there. So I think some degree of stress should be there. And this is not new. And I think our DNA is kind of groomed to handle this kind of stress. So I would say, don't worry too much about stress. Accept things as they are. It is what it is. You can't change things.
Yeah.
But I think, kind of better equip yourself to handle these everyday stresses, I would say. Okay.
Very true. Thank you. That was a wonderful message.
Yeah.
And I agree, one should not take healing too seriously also and just be in the healing process or in the comfort zone. A little amount of stress is okay. We must aim at getting out of that comfort zone. So I think that was such an insightful conversation. Thank you so much for all that you shared and your expert advice. It really means a lot because even though you are with your family, you're on a holiday vacation, you still took time to share such valuable information with all of us. So thank you so much, Madhu. God bless you.
Thank you, Sneha. Thank you. Thank you for that. You take care and you have a wonderful day. Bye-bye.
Yeah, thank you. And before I end the conversation, I just want to know if our listeners, our viewers can get in touch with you. Can I go ahead and share your social media channel?
Absolutely.
In the description box.
I would be very happy to talk to people if they have any specific questions in this space. And thank you for the opportunity again, Sneha.
Thank you so much. Thanks for your time. Take care. Bye-bye.
Take care. Bye-bye.